You know, it's funny how sometimes the biggest dangers are the ones hiding in plain sight, just obscured by everything else around them. Well, in the world of medical screening, that's not just a saying, it can be a life or death problem. And we're going to get right into it. Okay, so check this out. On the left, you've got a standard 2D mammogram. Looks pretty normal, right? But the image on the right, that's from a newer 3D technology called tomosynthesis, or DBT. And here's the kicker. This is the exact same person. And now, suddenly, a hidden cancer is staring right back at us. This really gets to the heart of what we're talking about today, how just changing our perspective, our dimension, can reveal what's been hiding all along.
For years, for decades even, 2D mammography was the gold standard. But, and this is a big but, it has this one fundamental limitation, and it's one that can have some pretty devastating consequences.
Think about it like this. It's like trying to read a whole book by just staring at the side of it, with all the pages squished together. I mean, you can't, right? That's exactly the challenge for a radiologist looking at a 2D mammogram. All the complex layers of breast tissue are flattened into one image, so healthy tissue can overlap and create shadows that look just like cancer, leading to false alarms. Or, and this is much worse, it can actually hide a real tumor, causing it to be missed entirely.
So, what's the solution? Well, what if you could flip through the pages of that book, one by one? You'd need to add a new dimension, and that's precisely what this next technology does. And that's where this technology, digital breast tomosynthesis, or DBT for short, comes in. Instead of just one flat picture, the machine kind of swings in an arc, taking a bunch of little pictures from all these different angles. Then a computer does its magic and rebuilds them into a series of super thin slices. It lets doctors literally scroll through the breast tissue, layer by tiny layer. I mean, the difference is just night and day, right? On the left, the old way. One flat image, everything piled on top of each other. And on the right, the new way. A whole stack of 1 mm slices. Suddenly, that whole problem of tissues overlapping and hiding things, it's pretty much gone. But what does that actually mean in the real world? Well, the results are seriously powerful. First off, a 15% drop in what's called the recall rate. And that's a big deal. That's 15% fewer people getting that heart-stopping phone call, the one that says, "We saw something, you need to come back in for more tests." That's a massive reduction in anxiety and stress. Okay, so fewer false alarms, that's amazing. Huge relief for so many people. But this next number, this is the real game changer. An incredible 41% increase in finding invasive cancers. You know, the really dangerous ones? So with DBT, we're not just cutting down on unnecessary worry, we are finding more of the cancers that are truly a threat, and we're finding them earlier. That's huge. Look, numbers and stats are one thing, but seeing is believing, right? So let's dive into some real-life cases where this technology made all the difference. Okay, take a look here. This is a 68-year-old woman who came in for a routine screening. Her standard 2D mammogram, on the left, was read as negative, all clear. But then look at the DBT image on the right. You see that subtle pulling of the tissue? Doctors have a fancy name for it, architectural distortion, but it's basically a red flag that something's not right, that it's pulling the tissue out of place. And that was an invasive cancer that absolutely would have been missed. And there's this great quote that really just nails why this is so important. It says, it's not always about how dense the tissue is. Sometimes it's just about how the normal structures are layered, creating confusion. DBT is what lets doctors see through all that noise. All right, here we go again. Another really powerful case. This time, a 46-year-old woman. And once again, her 2D mammogram came back interpreted as negative. Looking at it, you can see why. It looks pretty normal. But then, you look at the DBT scan, and boom, there it is. That same telltale sign, that architectural distortion. And this wasn't some tiny little spot. We're talking about a 6-centimeter invasive cancer, absolutely life-threatening and totally invisible on the old-style mammogram. Okay, so at this point, you're probably thinking, wow, this DBT technology is a miracle, and it is a massive leap forward for sure. But it's not the whole story, because even the best tool in the world is only as good as the person using it. And that brings us to the human factor. Check out this timeline. It's a tough one. For 3 straight years, 2011, 2012, 2013, this patient's screening came back normal. Now, looking back, we can see a tiny abnormality was there, just growing at a snail's pace.
It was so subtle, it was just mistaken for stable tissue year after year, until 2014 when it finally got big enough to be clearly called out as a mass. So what's the lesson here? It's a sobering one. Some cancers are just incredibly sneaky. They grow so slowly that the only way to catch them is with a super careful, side-by-side comparison with every single previous scan. It just goes to show you, diligence is every bit as important as technology. All right, let's talk about another classic, very human pitfall. In this image, a radiologist spots something called a hamartoma. That's a benign, harmless finding. You see it at the bottom arrow. It's pretty obvious, easy to identify, easy find. Case closed, right? Well, not so fast. Because if you look closer, up top, in the exact same image, there was something else. That subtle distortion, marked by the top arrow, that was missed. And that was the invasive cancer. In fact, the patient came back just a week later because she felt a lump in that exact spot. What happened there is a textbook case of something called satisfaction of search. It's a cognitive bias, a sort of mental shortcut. Your brain finds one thing, it gets that little aha moment, and it basically stops looking. It's satisfied. And it can cause even the best doctors to overlook a second, sometimes much more dangerous finding on the very same scan. It's a real reminder that our brains have these little quirks that can lead us astray. So after all that, where do we land? We've got this amazing new technology, but we also have these very real, very human challenges. What's the final verdict here? So let's pull it all together. What are the big takeaways? Well, first, it's undeniable that DBT is just a better tool. It finds more cancers and it causes fewer false alarms. Period. We've also seen how some of these cancers can be completely invisible without it. But the story doesn't end there. We've also seen how human factors, like missing slow changes or the satisfaction of search bias, are still a huge part of the equation. So the real answer isn't just about a better machine. The best defense is a partnership, the most advanced technology in the hands of diligent, experienced, and self-aware human experts. And that really brings us to our final question, the one I want to leave you with. Technology is giving us clearer pictures of the human body than we've ever had before. But as we've just seen, a clearer picture doesn't always mean a clearer answer. So the big question moving forward is this: how do we make sure our human eyes, our human intuition, can keep up? How do we train ourselves to see what's still hiding, even in the clearest picture?